Exercise and illness. Should you continue your exercise program when you're sick? The answer is no. If you have a fever, if your symptoms are severe, such as extreme shortness of breath, extreme fatigue, dizziness, irregular heartbeats. The answer is yes, you can continue if you feel your symptoms are not going to interfere with your exercise, if you ensure to slow down your pace and reduce the exercise duration. Remember to wait at least 48 hours after a fever to return to your exercise program. Following a prolonged period of inactivity due to illness, it will be very important for you to return to your exercise program gradually by reducing the duration and the intensity of your exercise. If you have a flare-up of your COPD symptoms, you should have an action plan and know how to use it when you're noting the following. An increase in your usual symptoms, so that could be more coughing, more short of breath, more wheezing, more secretions, or a change in the color of your secretions, how much there is, or the thickness. You should contact your doctor after 2 days of experiencing those symptoms and not getting relief from your usual treatment. In all cases, do not hesitate to seek medical attention or call Telehealth Ontario to get assistance. Here's an example of a COPD action plan. In the green zone, that's when you're feeling your usual self. You're sleeping well, you're taking your medication as prescribed, you have lots of energy, you have the usual amount of secretions, you're able to exercise, and so on. Your action is to continue taking your usual medication as prescribed to you. The yellow or orange zone, you're starting to feel a little bit sick. It's harder to breathe. You may have a fever. You might notice more coughing. You might notice more secretions, or your secretions are thicker than normal. There might be a change in color of your secretions. Your appetite is not the best. You're not sleeping great. Your energy is on the low down. And you have to take your rescue puffer more often. The action is to follow your plan and take the extra medicine as prescribed to you. If you have a rescue inhaler, you should know how much of it and how often you're allowed to take it in your day. You need to plan your day, get more rest and relax. Use your breathing techniques such as pursed lip breathing, the huff and cough to clear your secretions as needed. And you might consider contacting your primary care provider to discuss how you're feeling. Especially if you're going 2 days with those increased symptoms and it doesn't seem to be getting better. The red zone, this is bad news. You have trouble breathing, you might be wheezing. You're very short of breath at rest. You might have a high fever, you might be getting confused, you feel drowsy, you might feel chest pain, and you're very scared. It's time to call 911. Do not wait, even if it's on the weekend and you're afraid to wait a long time in the emergency room. Do not take the risk. Go to the hospital immediately. By ambulance is preferable.